You may have heard the term bipolar used casually to describe someone who is moody or experiences mood swings. However, the colloquial use of the term is quite different from clinically diagnosed bipolar disorder. Bipolar disorder, formerly known as manic depression, is a serious mental health condition characterized by dramatic shifts in emotions, mood, and energy levels. These shifts range from extreme lows, depression, to extreme highs, mania, but typically occur over days or weeks rather than moment to moment. Bipolar and related disorders encompass several conditions, including bipolar I disorder, bipolar II disorder, and cyclothymic disorder. Below are key clinical features of these disorders. Key features of bipolar and related disorders. 1. Major depressive episodes. Characterized by prolonged low moods, similar to major depressive disorder, unipolar depression. Symptoms include feelings of hopelessness, lack of energy, poor mental focus, and physical symptoms like changes in appetite or sleep patterns, e.g. too much or too little. 2. Manic episodes. Defined by an abnormally elevated mood lasting at least 1 week or requiring hospitalization. Symptoms include extreme energy, optimism, or euphoria. High self-esteem or irritability. Reckless behaviors, e.g. risky investments, impulsive decisions. Pressured speech, racing thoughts, and reduced need for sleep. Delusions of grandeur, such as believing in supernatural powers or having a divine mission. 3. Hypomanic episodes. Milder versions of manic episodes, lasting at least 4 consecutive days. While similar to manic symptoms, hypomania does not cause significant functional impairment and lacks psychotic features. 4. Euthymia. Between episodes, individuals often experience periods of stable mood, referred to as euthymia. Diagnoses of bipolar disorders. 1. Bipolar I disorder, defined by at least 1 manic episode, which may be preceded or followed by hypomanic or major depressive episodes. 2. Bipolar II disorder, involves at least 1 hypomanic episode and 1 major depressive episode, but no manic episodes. 3. Cyclothymic disorder, characterized by frequent hypomanic and depressive symptoms over a 2-year period, which are less severe than those seen in bipolar I or II. Symptoms must be present for at least half the time, 1 year, and without symptom-free periods longer than 2 months. Specifiers of bipolar disorders. Additional clinical features, or specifiers, can provide more context for individual cases. Anxious distress, feelings of restlessness or fear of impending doom. Melancholic features, intense feelings of guilt, early morning awakenings, and more severe depressive episodes in the morning. Rapid cycling, 4 or more depressive, manic, or hypomanic episodes within a 12-month period. Atypical features, normal mood responses to positive events, such as brightening up after hearing a favorite song, excessive daytime sleepiness and feelings of heaviness in the arms or legs. Fear of rejection, which can strain social relationships. Causes and risk factors. The exact causes of bipolar disorder are not fully understood, but genetic and environmental factors are believed to play a role. For example, individuals with a family history of bipolar disorder are significantly more likely to develop it. Bipolar disorders are frequently associated with other conditions, such as anxiety disorders, ADHD, substance use disorders, and personality disorders, complicating diagnosis and treatment. Treatment options. Although there is no cure, early diagnosis and treatment are critical to prevent self-harm or suicide. Treatment often involves a combination of pharmacological and psychological approaches. 1. Pharmacological treatments. Lithium salts, a mood stabilizer that is particularly effective at controlling manic episodes. Often combined with other medications to manage depressive episodes. Other medications, antipsychotics, anticonvulsants, and benzodiazepines. Note, some antidepressants, e.g., SSRIs, can trigger manic episodes in predisposed individuals, requiring careful monitoring. 2. Psychological interventions. Talk therapy or cognitive behavioral therapy, CBT not highly effective for manic episodes, but useful after manic episodes to address triggers and stressors. Can help individuals manage life stressors to prevent future episodes. Summary. Bipolar 1 disorder, bipolar 2 disorder, and cyclothymic disorder fall under the category of bipolar and related disorders, characterized by major depressive, manic, and hypomanic episodes. These conditions can be further classified by specifiers such as anxious distress or rapid cycling. While bipolar disorder has no cure, pharmacological treatments like lithium, combined with psychotherapy, can significantly improve quality of life. Identifying and managing these conditions is essential due to the potential risk of self-harm or suicide. Effective treatment and education can empower individuals and clinicians to navigate these challenging conditions more effectively.